Buruli ulcer is a serious disease which causes deterioration of the skin, muscle tissue, and even bone if left untreated. This necrotizing disease is caused by Mycobacterium ulcerans. The bacteria produces a toxin called mycolactone, which creates cellular apoptosis and immunosuppression. The toxin works by inducing necrosis of subcutaneous lipids, or fats, under the skin. These lipids are so severely damaged that the skin of the infected area begins to separate from the muscle and eventually falls off. Mycolactone is a particularly dangerous toxin because it also has immunosuppressive properties. This allows such critical tissue destruction to occur without any of the normal symptoms of infection, such as inflammation, fever, or swollen glands. This photo shows 4 stages of infection with Buruli ulcer in the hand of a man from Peru. Block A shows the beginning stages of infection, with some surface tissue damage. Block B shows how the bacteria begins to cause deeper tissue damage over time. In Block C, the skin surrounding the affected area has lifted from the muscle and bone tissue. Finally, Block D shows a healing Buruli ulcer after extensive treatment, including skin grafting surgery. This map shows areas of the world where Buruli ulcer is endemic. Mexico, Australia, areas of Asia and South America, and Western Africa are among those affected. The 18-month-old child in this photo contracted a confirmed case of Buruli ulcer in his ear after traveling to Australia. Although the child in the previous photo was infected in Australia, Buruli ulcer is most prevalent in Western Africa. This map shows the African countries most affected by the disease, the more severe areas colored in green. The initial symptom of Buruli ulcer is a painless swelling under the skin called a nodule. This swelling is caused by the toxin mycolactone beginning to deteriorate the subcutaneous lipids under the skin. The next step of Buruli ulcer is the formation of a plaque, which is a small area of surface tissue destruction that may or may not be painful. It is not unusual for an untreated case of Buruli ulcer to spread throughout an entire limb. A case as severe as this will definitely cause disfiguring of the infected area. However, the mortality rate of this disease is very low. 80% of Buruli ulcer cases can be cured with antibiotics if detected early. For treatment, the World Health Organization recommends a combination of rifampicin and streptomycin for 8 weeks. While nodules can be treated without hospitalization, more serious cases may require surgery to remove necrotic tissue, cover skin defects using skin grafts, and correct any deformities caused by the disease. Further research is being conducted in regards to creating a Buruli ulcer vaccine. However, there is currently a vaccine available offering some short-term protection called the Bacille Calmette Guerin, or BCG, vaccine. The exact mode of transmission for this disease is still unknown, but it is suspected that mosquitoes may be a vector, as Buruli ulcer is usually found in areas near rivers, swamps, and wetlands.